Hello, I'm Dr. Yub. Today I'm here to discuss a very important disorder that is called separation anxiety disorder. This is important in a sense if we identify this early and address it appropriately, we can prevent lots of suffering these child can face later in life. If we see separation anxiety disorder, it's important to know the difference from separation anxiety itself. The separation anxiety is part of normal development in growing child. At the age of 1 year, the growing child develop something we call separation anxiety. That is when the growing child is separated from the attachment figure, the child develops some problem that is called separation anxiety. The separation anxiety is a sign of developmental bonding or emotional bond with the caregiver. And with time, as the child grows, the emotional bond between the child and mother can become more secure, and the child can tolerate a temporary separation. This lead to development of another quality or skill which we call autonomy. So development of autonomy, secure attachment prevent the separation anxiety. But if the separation anxiety persists after certain age, that is, it persists after the school age, preschool age, or it is severe enough that lead to impairment of social functioning, then it is called separation anxiety disorder. Separation anxiety disorder, if we see the diagnostic criteria, it is the inappropriate and excessive fear or anxiety concerning separation from attachment figure, which can be evidenced by distress when anticipating or experiencing separation from home or from attachment figure, persistent and excessive worries about losing major attachment figure or about possible harm to them, such as an illness, injury, disaster, or death. Persistent and excessive worry about experiencing an untoward event like getting lost, being kidnapped, having an accident, becoming ill, that cause separation from a major attachment figure. These child also refuse to go to school, refuse to go to bed without attachment figure. They can experience repeated nightmare and somatization due to fear of being separated from attachment figure. The duration of the symptom must be present at least for 4 weeks. In young child and adolescent, the symptom should be present for 6 months. The separation anxiety is more common in young child, that is 3.5% equal male and female, but in adolescent, the separation anxiety decreases, that is less than 1%, more common in girls. The age of onset is young child. If we see the differential diagnosis of separation anxiety, there are certain things within the family like stressor, like family dynamics, the parents being overprotective, and certain psychiatric disorder can lead to separation anxiety or symptom of separation anxiety. So in that case, we have to rule out like mood disorder, neurotic disorder, phobic anxiety, social anxiety disorder. After diagnosing separation anxiety disorder, the mainstay of treatment is psychosocial, and as we mentioned that we have to treat the underlying cause, like if the stress, if it's related to stress, the stress management within the family is useful. Parent management training, if there's overprotective parenting, behavioral treatment, if this is due to certain phobias, and that case relaxation training, systemic desensitization are useful. The other modality of treatment include psychoeducation of the parents, child, cognitive behavioral therapy. Has this child avoid going to school? So early supportive return to school is also important component of the treatment. Certain cases of separation anxiety do not respond with non-pharmacological treatment, and this, in that case, review of the diagnosis is important, and we can consider certain medication for that. In children, for anxiety disorder, the first-line treatment is fluoxetine, which can be given over age 8 years, and the sertraline, which can be given over 6 years of life. Thank you for listening. If there's any question, kindly write in the chat box. Thank you.